In this environment of COVID pandemic, grief and personal tragedies are all around us.
Today, we will learn from a practicing clinical psychologist for 38 years and who has treated about 17,000 patients regarding how to deal with grief. Dr. Manjul Asthana will share her personal encounter with grief. Watch till the end to learn her self-realization techniques that she used to heal herself and subsequently her patients.
Hi, my name is Ritu Srivastava. Welcome to my channel, Ticklish Healthy Alternatives. Please share your thoughts if you are somebody who is dealing with grief at this moment.
Thanks, Ritu, for inviting me to share my experience.
Wonderful. So, Dr. Asthana, here's a question for you. Do you think grief and guilt go hand in hand?
Yes, Ritu, they are intertwined most of the time.
So, are we going to speak about grief or are we going to speak about guilt today?
As you mentioned earlier, that there are a lot of grief going on because of people losing their loved ones. So I will mostly talk grief this time.
Okay.
I mentioned they are intertwined, so it will be both a little bit. Let me share my story. In my story, grief and guilt were intertwined. And I'm talking when my mother died when I was 17. And I was not very responsible person. When my mother died, she was sick at age 42 and a few months she was bedridden. After that, I started realizing what she used to tell and make me understand about life, which I did not follow or understand. I followed whatever my father was saying. So at that time, I used to cry a lot. And one more thing, I was not worshiping at that time. I got so upset. Totally for 1 year. After 6 months, I got an aha moment that I started thinking how to move forward, not to stay stuck in the past. So at that time, I started thinking what to do to move on. And based on those, my own experience, I will share some techniques, you can call it, or self-help. So see if, we all can use it, and see it can help, or you can modify whatever way it works for you.
Thank you so much, Dr. Asthana, for sharing your personal techniques with the viewers of Ticklish Healthy Alternatives.
Okay, so first thing which I did, was self-reflection, to start thinking about things. My feelings, what they were when she was alive, when she died, and what I'm feeling now. So it took to get out of it like 3 to 6 months. So I started reflecting on my feeling. And so what I come up with, that express your feeling to yourself and own it, acknowledge it, accept it, but don't judge it. So when you say, okay, I'm feeling like this, that's fine. Whatever it is, that's your feeling. Nobody can take those feelings away from you. So try to understand your feeling. The second is when after somebody, loved one goes away or demise, find a time and a place where you feel solace in your room or in your house, and assign a time like afternoon, 3 to 4 or whatever time. And then say, okay, that time I'm going to think about my loved one, whatever I want to think. And that is my moment with them. So what happens that then your thoughts will come. It's not that they will not come in daytime about them. So you say, make a self-script. You can say, I will talk to you at 3 o'clock. I will, and it might keep coming in each time you say, I will talk to you at that time. So you are really addressing your mind and your thoughts to say, I will talk to you, but not right now.
Wow. So
So
assigning a time of the day to think about the person who left you sounds so simple and yet so powerful to manage the emotions to move on. Wow.
mhm. And especially managing your thoughts and
Mm,
mind,
mm,
distracting your mind from one direction, which helps you to go move forward from the place where you will be more down and crying. So that way you are learning to get the control back with your emotions, So that's the important thing. The other thing is that structure family gathering.
mm.
That is also very important. Like in India, we used to have 13 days we have after death. That whole family gathers every day. People come talk about the person. So we all talked about it, express the feeling. So I say here that have family gathering in the beginning, if once a week it's possible, or twice a month, and ask them to come and share your feeling about the loved one. Cry together, laugh together, share experience together from the same event. People have different way to narrate the story. Have it. And after you do, then have tea, coffee, or whatever. So what happens, you're sharing the grief together, which
Mm.
is healing, group healing. Everybody is healing themselves. And the person, like your spouse or whoever, you are healing also. So this is very important. Share grief with family or friends, whoever you want to invite.
They say sorrow shared is sorrow halved.
Exactly.
And you just provided us with the technique of how to go about it.
Yes, it's very, very important. Another thing is also very important to admire in your loved one, whatever you admired, one quality, attribute. You might have many, and you can have it, okay, I will adopt one quality of my loved one, my parents or husband or wife, whatever, and then follow it up in your life, daily life. How to translate? I'll give you example. Like, suppose your loved one was very caring, very gentle, and always cared for others. How you will translate is that you will also smile whenever you see anybody, even a stranger, and whom you don't like, sometimes appreciate something good in it, and call somebody whom you don't like, say hi. So what you're doing, you're caring, and you are healing, you are carrying that memory alive forever as their legacy with you, and making friends too. So
Wow.
yeah, that is very, very good in that, and very important to be with that loved one forever.
Mm.
Even now, I practice things which my mom told me at that time. And whenever I do, I think about her.
Wow.
So that's a very positive way to think about it.
Right.
And the fourth thing is nurture yourself. Means spend time with yourself, few minutes every day, and review your day. What goal you set up in the morning, in the beginning, okay, I will do this something. Like suppose adopting the quality. Today, whomever I see, I'm going to smile, whatever. Then have a review when you spend time that how was my day? But no judging, no putting yourself down. If you couldn't do it, fine. At least you thought about it, you made an effort. So nurture yourself, do some exercise physically, which helps the body and blood circulation. Then emotionally, meditation, do so quieting your mind and focus on yourself. So all these things you can do it to nurture yourself and stay connected with the friends. Very,
Wow.
very important, family and friends,
Mm.
because that helps the cognitive abilities. You think about them, you know what they're talking, how to answer. It's very, very important to stay connected.
Mm.
And so
So,
that is, yeah, go ahead.
no, I was just gonna say that nurturing oneself during grief is really hard. And you just gave us a practical technique of how to do it through exercising and meditation.
And that think that if you cannot move on, you're not moving on.
Yeah, that would have been my next question. That let's say people are unable to take the steps you have outlined to deal with their grief. Is there something that they can do now? And at what point do they know that they have waited too long?
What we do, in the sense, we gave them 3 to 6 months. If person is getting towards normalcy in their life, following the routine, enjoying it, not just doing it, surviving, okay, and then you're not contented and your always face is down. After 6 months, takes little bit, 3 to 6 months. After that, if you did not get back to your previous normal functioning level, then you should seek help, professional help at that time. If the things you're trying and it's not working. But the reference point is from your previous functioning level to now. And if you have not reached to there and you don't enjoy anything, that's the time. If you're not enjoying, don't feel like doing anything, that's the time to seek help.
And I was wondering, would you like to share your contact for people to reach you for support?
Definitely, definitely. And in this time of COVID, when a lot of people lost a lot of loved ones, and it is very intense grief at this time, and because there's unpredictability, untimely. So a lot of things, factors are here that people cannot manage their grief at this point, even right from the start, and cannot even think about doing anything, which I mentioned earlier. At that time, go to website, harmoniousmind.com, and there is a form there, consent for telemedicine appointment, and fill up the form, registration, your phone number and email. And then usually they inform me and I call myself to make an appointment to talk. You don't have to worry about paying or anything. It is related COVID. If it is COVID related and stress, COVID stress related, we are doing it in our outfit. We have psychiatrists also. So if I think they need thing, then I do refer to the psychiatrist also. So they can contact me and they don't have to have an appointment. If I call and they just want to talk, that's fine too.
Hey, Dr. Manjul Asthana, thank you for sharing your invaluable, tried and tested techniques via the Ticklish Healthy Alternatives channel to help people who could be suffering and not knowing how to seek help. Friends, if you have questions for Dr. Manjul Asthana, please write them in the comments below. You can reach her directly at theharmoniousmind.com. And if you find value in this video today, please share it with people who you think will need help in these unprecedented times. Be safe and be healthy till my next video.
Thank you.